Welcome back. Our next guest had major mood swings, was gaining weight for no reason, and had hot flashes that got so bad her heart was racing. But it wasn't a problem with her heart. Here to explain, please welcome Dr. James Kern, Medical Director for Ageless Med Spa, Dr. Bryant Herzog, Medical Director for Hormone Therapy Centers of America, and the new and improved Sandra Simon. So we touched on hormones a little bit earlier, but especially with women, because we're more hormonal, there are a couple of times in life when things kind of crash. After having a baby, it can happen, and just, you know, aging, right? Getting into menopause. You two, as OBGYNs, would hear women come back in and say what?
Basically, they would come in and talk about how they just weren't feeling the same. They had less energy, more fatigue.
And a lot of us would think, well, if you just had a baby, if that's the situation, well, that's because you had a baby, right?
And of course, emotional swings, and a lot of situations where they would come in and simply say they had trouble concentrating on things that they were trying to think about in focusing their attention to various things.
Yeah. And Dr. Herzog, there's a time when people would just say, well, that's what happens.
Well, yes, and so many times it still happens today when women are sort of patted on the back and say, oh, you have depression.
Yeah. So what will you do for that? We have a prescription for you.
Yes, yes.
Right. But those are all the things, all the symptoms that you would hear a woman say to you are all the things that tell you there's a hormone issue.
No question about it. We know that many of those things overlap, and that's why some physicians who don't keep up with the modern literature and science and so forth get behind, and they're not able to deal with those women and understand that that is a hormonal deficit that happens normally in their life.
Yeah, that can be
fixed.
fixed.
And has nothing to do with pregnancy.
You being crazy. Yeah, you being crazy. All right, Sandra, you kind of got that slap in the face where life was not what it used to be. What was happening with you?
About 3 years ago, I started experiencing night sweats, being tired, restless nights, and mood swings, irritability, weight gain.
And you're tired, yet you couldn't sleep, right?
Couldn't sleep.
All right, and what did you think it was? Did you think it was the time for the change?
Yes, I did.
Yes, I did. And everyone in the house knew that too, didn't they?
Yes.
Right. All right, so it's a natural thing that happens, but what we're saying is that you don't have to go crashing into menopause. You can glide through it, and there's different things that you can do, obviously replacing the hormones. You all like to use what's called the pellet. Tell us what that pellet is.
Basically, the pellets, they're about the size of a Tic Tac, somewhat thinner. And it furnishes bioidentical hormones. What I mean by bioidentical is simply hormones that are much closer in compound to what a woman forms, or I should say, people form naturally, because we use bioidentical hormones both for men and women.
See, I knew it. They go through their own form of menopause called andropause, right?
We do have that, yes, indeed.
Yeah, and then, of course, your body feels like it's making its own hormones. We certainly know with the synthetic hormones, a lot of times people's bodies don't really react to that well.
Yes.
All right, and I guess we should back up in a minute and say exactly what do hormones, what role do they play in the body?
Well, the hormones are the keystone of many, many chemical reactions in our body, in our brains, in our organs, in our personalities and so forth. And those hormones have exact purposes, and they travel to areas in the body where they do their work, like thyroid and, of course, our sex organs and so forth. But as we age, they start to diminish. Now, in menopause, it's more of a drop-off or a crash, but testosterone can start as early as late 20s and early 30s, just to start to trickle down very slowly and very slowly.
And a lot of people think women don't have testosterone. We do, just not in the amounts that men do.
They have a touch of testosterone, just like men have a touch of estrogen and progesterone, the female hormones.
Yeah. And Sandra, not to get too personal, but I bet you didn't want your husband even looking at you, did you? Don't even look this way. Not happening. But with a little extra testosterone, you realize why you married him, right?
Yes.
Okay. So just saying that it affects all those types of things. Okay. So back to that pellet. So it gets inserted. You determine how much of what a hormone that somebody might need.
Basically, what we will do, we'll do the blood test to get an idea of their level of hormones compared to norms, compared to what we consider within normal limits. We will then talk to the patient, check their symptoms, what they're going through, and we'll send this information to the compounding pharmacy that'll make up the hormone pellets.
Just the dosage that's just right for you.
Yes, just right for you. Then we will put them in the patient. We'll see them back again and do another blood test to see how they're doing, to see if we need to do a slight adjustment of the hormone levels. But once again, we will talk to the patients and will, in essence, try to tailor this hormone dosage to the individual patient rather than using the one-size-fits-all.
And how do you feel today?
Great.
Great, right? A new woman. Back to your old self.
Yes.
I just want to say it's not about just feeling great, but the things that we might not realize, especially with things like testosterone, that's also something that helps our body, good for muscle strength for your heart, right?
There's no question. Testosterone in a woman's body has over 3,000 functions. And a lot of women don't even know that they have testosterone in their bodies. It's also the most active hormone in a woman's body, so it affects the heart and the memory, their sleep at night. Women complain of night sweats. That's all from testosterone. Hot flashes during the day are from estrogen. So it's an evolving science. It's evolving to knowledge for women, and they're starting to understand more about it. And it's our job to get their hormones back to what they were when they were in their late 20s
and what we're talking about
early
is balancing,
30s.
not imbalance, but to balance them. All right, you don't have to go crashing into menopause, like I said earlier. If you'd like to learn more about bioidentical hormone pellet therapy, Ageless Med Spa is hosting a free patient seminar on Thursday, May 4th from 4:30 to 7 p.m. It's at 414 West Grand Parkway, South in Katy. You can call now to reserve your seat or make an appointment, 281-392-3700. 281-392-3700. And for more information, visit agelessmedspakaty.com. And that way you can ask questions. At least start by asking questions. Thanks again.